want to buy you a mic to wear because I'll be like watching it at home on my TV. And
I'm not gonna wear a mic.
And then.
And when I laugh, my laugh is so loud.
Right next to the microphone.
Yeah.
Yeah, my laugh is so loud.
Adjust the volume constantly.
Yeah, and my husband's like, "What are you watching?" I'm like, "Don't worry about it."
I'm not wearing a mic. I'm loud enough. Let's just go ahead and acknowledge that. I'm not like a shy little flower.
No, it's just when you walk away and come back. That's when you're like.
I know. Somebody told me that the first time. They were like, well, you need to like stand in one place. I was like, you need to shut up and appreciate what you have in your life.
It's true.
You need to shut your pie hole. Okay, so we are going to finish just the last little couple actions. And then today, the first part of the day is me giving you some parameters that will help you make lab memorization doable. I can really help you with this if you just like give me some time to do it. And then because, how many of you guys missed your lab yesterday? Damn it. That was some crap luck, right? Okay, I don't know what they're going to do about it. I know that what they're not going to do. What they're not going to do is take off any of the material. So that's not going to happen. But there was an engineered review week before your practical. So what they may do is divide it up so that like they do a little in the review week and it's not just totally review. Does that make sense? Okay. So it kind of depends on what they want to do. They still have to cover all the same bit of material and you have to be tested on it. I will go ahead and tell you that it's worth a shot. It's not a decision that I get to make to go to SLCC Anatomy, go here and see if there is a lab that you could attend. The lab schedule's right there. You can look.
Our lab teacher emailed out yesterday and said, just find one.
Find one. Most of the lab instructors will say yes if you want to make one up today or tomorrow. It's better to make it up than to go to Open Lab, even though you can't be required to make it up. And why? Because Open Lab actually doesn't have any instruction in it, right? It's just come look, right? But so you will miss the instruction portion. And if you want to ask permission, you're welcome. You can just pop it up right here and it'll email the person, right? If you want to go to Ken's lab, it'll email him from right there. And he will probably say yes. I think all of them will probably say yes this week. So if you can make that work on in your schedule, it will benefit you. If you can't, it's probably not going to hurt your grades. It's not like they're going to say, oh, you missed a quiz and I'm going to ding you. But it will hurt your capacity to like absorb the material. Right? You're just going to miss some instruction, which would be not ideal. So, especially since that is literally the hardest lab of the semester.
Yay.
Yeah.
Do not miss this week.
Yeah. Do not miss it. I don't know what to do. It's freaking nature being a jerk. Thanks, nature. Actually, it was a really nice day, wasn't it? Oh my gosh, it was my I have a golden puppy, Superfly. Superfly loved the snow. It was the cutest thing. He was making tunnels and he would just get lost and then he would pop up and there'd just be snow everywhere. I was like, I could watch this all day long. Okay, so last little bit is the only thing that we didn't do with you guys are just these movements, right? Elevation. We didn't do those, did we? I think we did the jaw, but not opposition. Yeah? Did we do the jaw?
I think we did ankles, eversion, inversion.
Okay, last one. Okay, last one was me standing up on the table. So let's just do briefly the jaw movements and then opposition. So these are not exclusively jaw movements, especially elevation and depression, but protraction and retraction are moving your jaw. And if you move the jaw anteriorly, so you end up with an underbite, that's protraction, right? If you move the jaw posterior, so you end up with an underbite, overbite, that's retraction. Those two are part of course, chewing, right? You don't just go, right? You have to like go side to side, which I didn't make you learn, and also anterior to posterior. And then the other part of jaw movement is elevation and depression, right? Elevation would be pulling up, jaw elevation, right? And then depression, pulling down, okay? And what do you think? Where's a muscle going to be that's responsible for elevation of anything? Yeah, it's going to be on the top side, superior side. And the muscle responsible for depression will be on the bottom side. So we will see, of course, that when you will run into muscles that do elevation that aren't there, like you have a levator scapulae. Not only do I know where it is from the name, I also know what it does, right? It's on the top of the scapula, and it elevates the scapula, right? Levator scapulae, does that make sense? Okay, so I'll have elevation and depression. And then the last one the last movement, and then we're going to start to reinforce these with muscle naming, is called opposition. And opposition is opposable thumbs, right? We are one of the few species that can take our thumb and has the flexibility to make it touch all of the other fingers. This is opposition, okay? Lots and lots of flexibility with opposable thumbs. And because of opposition and a hinged jaw and a big brain, that's why we got some global warming going on, right? That's why. So we've got opposition going on. All right, so now what we're going to do is I'm going to try to teach you the conventions by which skeletal muscles are named. And what this is not going to do is to teach you every muscle in lab, because you know you're going to have to just sit down with those. But it's going to teach you how to get information about the muscle out of the name of the muscle, right? So that you don't have to do rote memorization of everything, because there's a tremendous amount of information in the names of the muscles that will tell you where to look for them, what they do, where they're attached, all that kind of stuff. So that's what we're going to do today. So there's several different ways that muscles are named. The first way that muscles might be named are actions. Now, you don't have to write down the examples today, but I would make sure that you write them down at some point, right? Some of you guys may not be comfortable enough to come up with examples, but make sure that you are at some point, okay? So muscles are named, one of the ways that muscles are named are for the action of the muscle. So let's talk about muscles that are called flexors. If a muscle has flexor in the name, you will almost always look for it on what side of the joint? The anterior, right? So muscles here that run across the wrist, right, would be wrist whatters. Flexors, yes, right? So don't name anything right here an extensor, because that ain't smart, okay? Does that make sense? So you've got flexors here. So for instance, does anybody remember, and I know some of you guys haven't had lab, only the Tuesday people here, but does anybody know a muscle that's called a flexor? Okay, flexor carpi ulnaris. And we will see that from what she said, that's going to tell us a hell of a lot of information. So muscles are quite often named like this. This is not a rule that isn't broken. You know, there's an exception to every damn thing. But if you got a muscle with like 72 words in it, here's the order of the words. The first one will be action, flexor, yes? The second one will be insertion. It's going to insert on the carpals, which tells you it moves which joint? The wrist, okay? The third will be the location, right? Flexor, carpi, ulnaris. So where is it? On the medial side, right? And I might have a radialis, right? Got it? Flexor, carpi, radialis. And then sometimes there's special information, like longus versus brevis, superficialis versus profundus. Like if there's two of them, then there'll be special information. Does that make sense? So this is telling you a hell of a lot of information. So we just have to break it down and figure out how to pull it out of the name, right? And then it's not a dump truck of information that you have to memorize. It's really just engaging your brain and saying, okay, this is the flexor digitorum profundus. Okay, let's think about that one. So a flexor carpi flexes the carpals. What does a flexor digitorum do? Show me. Digits. So the tendons have to go all the way down into the digits, right? And then if it was profundus, what does that mean? There's two, and it's the deep one. Yes? There's a superficialis and a profundus. Does that make sense to you? Okay. So what we're going to do today is practice to the point that we start getting confident of picking out the names, picking out the meanings out of the names. Okay? And then even the ones that I don't use as examples, I want you to go pick out the meanings of the names. Okay. So we've got flexors. Does anybody know any extensors? Any extensors? You have extensor digitorum. Where the hell am I going to look for that? I'm going to look for it on the back side, going all the way down into the digit. Show me digit extension. Right? Does that make sense? Okay. How about the extensor pollicis longus? Where am I going to find that one? Extensor, back side, inserts onto the pollex, okay? And there's two of them, and it's the longer one. Does that make sense? Extensor pollicis longus. That means that if I've got a tendon right here and a tendon right here, the extensor pollicis longus is not this one. Does that make sense? Okay, and you will have a whole bunch of them. So we're going to practice these. So you got flexors and extensors, tons of examples of each one of them. With this, I'm specifically looking at muscles that are named flexors or named extensors. Okay, but you also can have some adductors and some abductors. Okay, if I have a muscle that's called an abductor, should know where to look for it. Where should I look for a muscle that does let's do adduction first. Adduction. Medial surface. Have you met any adductors? There's a whole group right here of adductors that adduct the what?
The femur.
Yeah, they adduct the thigh or the femur. Exactly. Does that make sense? Okay. So let's go ahead.
Oh, I was just going to say adductor longus.
Yes, adductor longus, magnus, brevis, right? Does that make sense? It's a whole group right there, right? Does that make sense? Okay, so let's just back up just a little bit and make sure that everybody got this message in lab, and you probably did. We need to make sure that we say leg when we mean leg, thigh when we mean thigh, arm when we mean arm, and forearm when we mean forearm, okay? So those mean different things in anatomy, okay? So where's your arm anatomically? It's here, yes? Okay, so if I say I'm flexing my arm, I'm doing this, right? But what's this? That's my forearm, okay? The anatomical name for this is brachial, right? And this is antebrachial, okay? So where's my leg anatomically? No, this is not your leg, this is your leg, okay? This is flexion of the leg at the knee, yeah? This is your thigh, okay? This is flexion of the thigh, totally different, right? Flexion of the thigh at the hip, okay? So you have to use those terms really specifically. Arm, forearm, thigh, leg, okay? What's the word for thigh? Femoral. And the word for leg is crural or sural. Yeah? Does that make sense? They don't use that one very often. They usually just say leg. Okay, so let's just make sure that we understand what we're talking about when we look at, okay. Muscle that is a levator, okay. Have you met a levator yet? Levator scapulae. It's going to be on the top. Have you met any depressors? I don't think you guys know one, but I'll tell you one so you'll understand the name of it. The one that's named depressor. Okay. You don't have to know this one, but I bet you can find it if I tell you what its name is. It's called the depressor anguli oris, and it does this. Depressor anguli oris. Right? Pulls down the angles of the mouth. Does that make sense? Okay. Depressor anguli oris. All right, so let's do the next one. How about a pronator and a supinator? Okay. Where do I look for those muscles? Where are the muscles? Just approximately. What joint do they cross? Joint. You think this is? That's not it. Yeah, it's the elbow, right? So, that's pronation and supination, okay? You're going to learn a pronator and a supinator, and if you sit here and think about it, I'm going to let you chew on it and play with it a little bit, you can probably figure out which one's on which side of the joint, where the pronator is going to be and the supinator is going to be. I'm not going to tell you. I want you to think about it and figure out whether you can figure out. Sometimes you can tell by which muscle tightens when you're doing the action, right? So the pronator and the supinator are going to be specifically elbow muscles, right? And they're going to be located on the medial and the lateral surfaces, right? You just kind of have to figure out which one's going to do which, right? So they're going to yank those muscles. So think about it, and then you'll find them later. Okay, and then rotator muscles. This is not the name of an individual muscle, but it's the name of this group of muscles called the rotator cuff that you've heard of before. And the rotator cuff, among other things, is responsible for doing rotation, right, of the humerus, right? So those are the rotator cuff muscles. Those are easy to rip. Sphincters we're not going to run into in this set of notes so much as you run into them later. A sphincter is simply a circular muscle that controls the diameter of a tube, right? And you have a bunch of smooth muscle sphincters, but you got two skeletal muscle sphincters that you control at the distal end of your urinary tract and the distal end of your digestive tract, right? Those are sphincters. And then we have one muscle that you're probably learning this week called a tensor. Do you know where your tensor is? It's the TFL. It's really, really hard to spell. Tensor fascia latae. Okay, so let me ask you a logic question. If it's out here, this tensor fascia latae, do you think that one is more likely? Give me an action that you think it might help with. Abduction, yes, abduction, yeah. Oh, we didn't go back to, let's go back to, we did adductors, but we didn't do abductors. Let me teach you an abductor, even if you haven't heard of it before. There's a muscle that you're going to do this week called the abductor pollicis. Find it. Where should it be? Abductor. What surface? Lateral surface. Okay. So you're going to have 3 tendons right here because it's really important, right? Because of this whole opposition thing to be able to do a bunch of things with this finger. You're going to have the ability to do flexion of the pollicis, right? Right? That makes sense? But flexion, just going anteriorly, right? Abduction, yeah. Okay. And extension of the pollicis. You don't have as much movement that way, but you can move it back. And I'm going to have 3 tendons going there, at least 3, right? Tell me how to find the 3. If I've got a flexor pollicis, at least 1, an abductor pollicis, and an extensor pollicis. What order should the tendons be in? Flexor, abductor, extensor. Yes, exactly. So let me tell you this, and they'll tell you in lab too. Do not be a memorizer without actually following the muscle to its attachment. So a lot of people will go, okay, that's the extensor digitorum, or that's the flexor carpi radialis. You need to follow it to get to the point that you can convince yourself that it actually inserts on the pollex or inserts on the carpi, right? So you don't just name a muscle by looking at its belly. You follow its tendon to make sure that those freaking 17 muscles, or what the hell ever, in the forearm, they're so hard, right? They're hard for me. You need to be able to tell a way to tell them apart from one another. And it's not rote memorization. It's this one's going to the thumb. That's got to be one of the pollicis ones. This one's going all the way to the digits. That's got to be a digitorum, right? And then you start piecing it out, trying to figure out whether it's a superficialis or a profundus or a longus or a brevis, right? So you have to practice with that. Okay. Now, the other way, well, there's like 4 different ways, 5 different ways, muscles are named, and we're going to practice these as we go through, is that muscles are sometimes named by the orientation of the fibers or fascicles. So orientation of muscle fibers. So if you have a rectus muscle or a transversus muscle, rectus means that the fibers are erect. Like the word erection. You're never going to forget it, are you? Straight up and down on a good day. The fibers run parallel to the long axis of the body, okay? Now, you can't actually see the fibers, just so you know. Fibers are microscopic, but there are bundles of fibers called fascicles, and you can see those with the naked eye. So you can see the direction of the fibers because of the direction of the fascicles. And if you're like this dude, you can see the hell out of them, can't you? How long do you think it's been since he had mashed potatoes? So long, right? That's why he doesn't look very happy. So if you have a muscle that has straight up and down fibers, it's called a rectus muscle, yeah? So you have 2 rectus muscles. You might already know them. Which ones?
Rectus abdominis.
Rectus abdominis, straight up and down over the abdomen, and the rectus femoris, straight up and down over the femur. Does that make sense? Okay, that's what it's telling you. So if you see a muscle that's straight up and down over the femur, that's the one you should guess, rectus femoris. Good? Okay, sometimes muscles are transverse. So I have a transversus abdominis, and muscles that their fibers run transverse, it's almost at a right angle to the long axis, right? So I'm going to have a rectus abdominis. Deeper, I'm going to have a transversus abdominis. It's not very hard to tell them from one another when you know that rectus means straight up and down and transverse means that, right? I also have 2 more. I only wrote one of them down, but the other one I'll tell you it's pretty easy. I have oblique muscles. Oblique muscles are neither parallel nor perpendicular to the long axis, but at some angle to the long axis. So I have external obliques, right? And their fibers run that direction. You can see the hell out of them. And this dude right here, woo! Look at that. Those are external obliques right there, okay? Got external obliques. External obliques run this way, x to the sex. They're running toward that direction. And then internal obliques are also running oblique, but their fibers run the other way, okay? And it's easy to remember which one's which because external obliques are external in two ways. They're both more lateral and more superficial, right? And then when you peel those off, you can see the internal obliques that are both more medial and deeper. They're internal two ways. Yeah? That makes sense? So hands in the front pockets, that's external obliques. Hands in the back pockets, that's internal obliques. Make sense? So those are oblique muscles. By the way, even though these aren't called oblique muscles, I will go ahead and tell you that your intercostal muscles also have oblique fibers and they have the same pattern. When you get to intercostal muscles, the external intercostal muscles run the same direction as the external obliques, and they're external two ways, both lateral and superficial. And the internal obliques are internal two ways. Fibers run the same, or internal intercostals run the same direction as the internal obliques, and they're both medial and deeper, right? So it makes it easy to tell the difference between them once you've already learned the obliques. And then the last ones, I didn't write it on there, but we can go ahead and do it. What if you had a muscle called an orbicularis? What's that kind of telling you about the direction of the fibers? Yeah, circle. So I'm going to show you two, and I'll bet you are brilliant and you can figure out which one's the orbicularis oris and which one's the orbicularis oculi. That's the orbicularis oculi. Runs straight around, right? Causes the eye to close. And that's the orbicularis oris, and it causes the lips to close. Okay, so let's make sure that when we remember how we played Magic School Bus when we were talking about tissues, you have to kind of do the same thing, but be really specific when you're talking about muscles. People will sometimes tell me that the orbicularis oris, and when you guys learn it later, they will say the orbicularis oris closes the jaw. It doesn't. It closes the lips, right? Right? The masseter, this one, you have to be attached here onto the mandible to close the jaw. So the lips are different than the jaw. Does that make sense? The lips are different. All of these muscles, by the way, the ones that are on the face and responsible for facial movement, those don't usually attach onto bone, right? Those just attach onto skin, and they move the skin of your face around, right? Most muscles we're used to having attachment points on bone, but these, the muscles of facial expression, those attach onto your skin. Is that okay? They're still considered skeletal muscle. They're just skeletal muscle that's a slight exception to our rule of what skeletal muscle does. So most skeletal muscle does attach to bone, but not all of it. Some skeletal muscle actually attaches onto other muscle too. Like you can have a muscle that pulls on another muscle, right? Okay, so these are facial muscles. You'll learn those next week. Okay, so muscles are also named for their specific body regions or relative locations, and this isn't hard. You are smart enough and you studied early this semester, so you are not going to be the person that doesn't know where to look for the brachialis muscle. Yes? Okay. You know where to look for it. And you're not going to look for it in the forearm because that's not what brachial means. Brachial means up here. And if I told you just a little bit more information and I said, okay, the brachialis muscle crosses the anterior surface of the elbow, you could not only find it, you could also tell me probably what it does. And what would that be? Flexion at the elbow, right? Flexion of the forearm at the elbow. Is that okay? Right? So there's a ton of information that you can get just by using your muscle logic. Okay, now I have a muscle called the rectus femoris. It is telling me two things about the muscle. Fibers straight up and down running over the femur. Got it? Yeah? Good. How about, where am I going to look for a muscle that's called an intercostal? Between the ribs. This is why I made you learn all that vocabulary at the beginning of the semester, because you did that before you were about to cry because of all the cadaver muscles, right? You got it the hell out of the way. All right, how about vastus muscles? Vastus muscles. What does vastus imply to you? Big. They're big muscles. They're vast, yes? Okay, but I have three of them, and I want you to help me find them with reference to one another. Okay, anybody know where these muscles are? Yeah, they're part of the quadriceps. That's 3 of the 4 quadricep muscles. The other one we already talked about. Let's peel it back. It's the rectus femoris. Peel it back. Peel it back. Now help me find the vastus lateralis, intermedius, and medialis. Lateralis, intermedius, medialis. Stick the rectus femoris back on top, and you've got the quadriceps femoris group, right? So it's not hard because that's like a little less than half of the thigh muscles right there. And their names make perfect sense based on where they are. Is that good? Okay, so flexor digitorum superficialis. Help me figure out what I can figure out about that. Find it for me. First, which surface should I look for it?
Interior.
Anterior surface. Going where? To the digits. And then if it's superficial, it means that there's one that's deep to it, right? Flexor digitorum superficialis, I would find that one. And if I wanted to see the profundus, as in profound or deep, peel that one back, look under. And it's going to go to the same place, approximately one of them. That goes actually a little further onto the digits. But flexor digitorum superficialis and profundus, right? So you know exactly where to look for them, okay? How about a supraspinatus versus an infraspinatus?
Super is above the spine.
Supraspinatus is above the spine, infraspinatus is below. And it's actually the spine of the scapula. That's where those are. And do you know that if you like look at where the muscle is, you can not make rookie mistakes about the function of the muscle, right? So the infraspinatus is probably not going to be related to elevating the scapula, right? That doesn't make any sense, right? It's on the wrong side to elevate the scapula. Got it? So then you can figure out like how does the action of that muscle actually make sense based on my prior association. Okay? All right. And now let's get to shapes and then we'll practice with these a little bit. Muscles are also sometimes named for their shape or their structure. Why is the deltoid called the deltoid? Because it's shaped like a triangle. Now, let's go a little harder and see how many of you guys remember 7th grade, 8th grade geometry and say, what's the trapezius shaped like? Trapezoid. But what's a trapezoid shaped like? Yeah, it's shaped like a diamond. Good, exactly. So the trapezius is this little bugger right here, right there, okay? The trapezius is diamond shaped, right? It's an interesting muscle when you get to it next week. It's kind of counterintuitive because it has attachment points that go below and above the scapula. So it's one of those weird situations in which the muscle can actually do two things that are kind of opposite one another. A couple of its actions are antagonistic actions to another because it goes up and it goes down. It's a weird muscle. So don't be surprised that it's got some functions that maybe seem counterintuitive. So this is called the trapezius. For some reason, I had the hardest time remembering when I was in college the difference between the trapezius and the latissimus dorsi. But then somebody's like, well, one of them shaped like a trapezoid dummy. And I was like, oh, okay. So that's the trapezius. That's how my education went. Like, oh, everybody knows this but me. Thanks. Okay, where would I look and what shape am I looking for a muscle called the quadratus lumborum? Quadratus, what does that tell me? Yeah, it's a little it's a little rectangle, yeah, four-sided. And where is it? Yeah, so don't be at all surprised that you've got a quadratus lumborum. It's a little rectangle-shaped muscle that's right here in the backside, right?
But doesn't it hook around the side too, like next to your abdominals with the...
No, not that. Are you thinking about the serratus anterior?
No, it's kind of like deep in here, isn't it?
It's way deep, yeah. Sometimes you even actually look at the quadratus lumborum with an anterior dissection. Like take all the guts out and then look at it from that side. Okay, is that good? So that's a quadratus lumborum. Okay, serratus anterior. What's it telling you? Remember, we're dealing with shapes and... Yeah, it's saw, and it wraps around the anterior. And luckily, he's happy to show us his serratus anterior. Right there, do you see it? It's serrated like crazy, man. Okay, serratus anterior. I wonder what percentage of body fat that is.
Like 5.
Yeah, that's amazing. I don't think he'd be very fun to hang out with, do you? No, because you'd be like, would you, huh?
It's like he lives at the gym and has some personality.
I know. That's why he doesn't look happy, because he forgot what mashed potatoes taste like, and that's why he's not happy. And he hasn't had a cocktail in like forever. Okay, serratus anterior. How about the platysma? You might not know that root, but plat, like the duck-billed platypus. What does plat mean? Flat, exactly. Here's your platysma. It's a big flat muscle that's from here to here. It goes, platysma. Yeah. That muscle's super duper thin. It's really hard to hold on to the cadavers so that's a platysma. It's flat. Okay, good. All right. And then sometimes muscles are named for their size. FYI, if there is a longus, there is a brevis. You might not have to know it though. But if there was a superficialis, there is a profundus, even if you don't have to know it, okay? But you don't have to know all the muscles. You know 95, and that will seem like plenty to you. but if it's got that special information, there is another one, and they're distinguishing. So if you have a longus and a brevis, do you guys know any longuses or brevises yet? You know any? You can look at your lab list if you want.
The femoris? The femoris longus?
We have a peroneus longus and a fibularis longus and brevis. Yeah, there's a fibularis longus and a fibularis brevis. So I need to tell you something important about longus and brevis muscles and also long heads and short heads. It's not referring to the length of the muscle. When you have a longus and a brevis or a long head and a short head, it's referring to the length of the tendon. The muscle itself could look way longer on the short one and shorter on the long one. So it's always referring to the length of the tendon. So, for instance, it's even true when you're looking at the biceps brachii. It's got a long head and a short head. But the long head is called the long head because it has a longer tendon. It actually attaches further up here, right? Does that make sense? Oh, I forgot to turn it on for you.
Yeah.
Okay, hold on. And then the short head actually, it attaches, it doesn't go as far. Does that make sense to you guys? Okay, so just go back out there. I'll turn it on for you. Give me a second. You guys have to wait for a second because I have to do something for her. Hopefully it won't take very long. Okay. I promise it'll just take a second. Okay. All right. Okay. That whole long tendon versus short tendon thing is yet again one of the reasons that you need to follow the muscle to where it's going, right? Follow the tendon all the way so that you can convince yourself that one of them's a longus and one of them's a brevis. Okay, a vastus muscle, vastus means great or big, okay? It's like vast. So we already met some vastus muscles, right? The vastus muscles are part of the what muscle group? The quadriceps femoris group, right? And there's 3 of them. So we already met those. Those are great. Okay, major means that it's bigger than another muscle near it. Does anybody know a major muscle?
Teres.
Oh yeah, I wasn't thinking about that. You've got a teres major and a minor, pectoralis major and a minor, and then you'll have a rhomboid major and a minor, okay? And if there's 2 of them, then the major is going to be bigger, right? And the pecs are easy because like pectoralis major, everybody's known that muscle, right, for a while, right? And he would be happy to show you his. There's his pectoralis major muscles right there. You can't see his pectoralis minor muscles because they are deep to the pectoralis major muscle, okay? Now, you have some other majors and minors, and in most cases, this is not a hard and fast rule, but everything except the pecs, the minor is on top of the major. So if you've got rhomboids, it'll be minor over major, right? And teres, it'll be minor over major. There's a pair of them. They're really similar in shape, but you've got one that's slightly smaller. The small, to me, with the teres is a little hard to tell which one's smaller, but you can definitely tell them with reference to one another. And they kind of have similar functions, not exactly the same functions. Okay, that's your majors and minors. Maximus, minimus, and then this one you actually have a medius. What is maximus muscles? Glutes, right? Gluteus maximus, gluteus minimus, and there's gluteus medius in the middle. And there are 3 big muscles, but one of them's bigger than the other, right? And of course, they're in the gluteal region, so you're going to know exactly where to look for them. It's not going to be very hard. Note, the gluteal muscles, most of them, they're slightly different in their functionality. They cross here. So what do you think a function of the gluteal muscles is?
Extensions.
Extension of the
Thigh.
thigh. Yes. At the hip. Yes. Got it. Exactly. Good. Okay. And then this is how I wish all muscles were named because there's so much information in it, but most muscles are not named this way. When muscles are named for their attachments, it not only tells you exactly where they are, it also pretty much tells you what they do because the origin is always listed first and then the insertion. So if you find a muscle that is called the brachioradialis, not only do you know exactly where to look for it, but you can pretty much figure out one of the functions, right? The brachioradialis, right? And if I tell you it crosses the anterior surface, then you already know its action, don't you? Flexion of the at the flexion of the forearm at the elbow, right? You don't have to always write all that out. I'm just trying to get you into the habit of being specific about what you're talking about. Is that good? Okay. All right. So how about the sternocleidomastoid? The origins are listed first, and then the insertion. Sternum, cleido is clavicle, to the what? Mastoid process of the temporal bone. Okay, so the sternocleidomastoid. I want you guys to feel this one because this muscle confuses the hell out of people, but you know where it is, right? You can see it right here. Can you see it? Okay, you can see it on you guys too. Okay, so put your hands on your neck so that you can feel yourself do this. Let's look at what you can do if you use both of these at the same time. Contract both of them at the same time. You will do what to your neck? Flex. Yes? Flex your neck. Okay. Do just the right one. You will do lateral flexion, right? To the same side, right? Do just the left one. Lateral flexion to the left side. And this is the part that's counterintuitive. These muscles also allow you to turn your head, but I want you to turn your head to the left and figure out which one is engaged when you're doing that. Yeah, you're actually pulling from the right side, which seems counterintuitive, but look, it's going from here to here, and it's yanking, pulling on this sternal end, right? Now turn your head to the left, right? So it's the opposite side. It's counterintuitive, isn't it? But you can feel it happening, can't you? Right? If I turn my head to the right side, I know that it is my left one. You can even see it, right? Can't you see it in me? Right? Turn my head to the right side, it's the left one that's doing it. You can see it. Turn my head to the left side, it's the right one that's doing it. Right? Okay? Is that good? So because I have two different functions and because this one has the ability to yank from here to here, it can turn my head to the opposite side. So if you're doing flexion, it flexes to the same side, right? Or anteriorly. But if you're doing turning your head, it turns it to the opposite side. Right? And that confused the hell out of me for the longest time until I was like, oh, I can actually feel it happening. But I just stick my hands on it. Go ahead.
So it extends to this, sorry, so it goes from the left mastoid process.
Other way, it starts at the sternum, goes to the left mastoid process. That's the origin, that's the insertion. Right? And with that, you're not really, you can feel that you're not really using the clavicular end when you're doing that. When you're rotating, feel it. Rotate and feel that it's really this one that you're using, right? But if you do this way, do lateral flexions, you can feel that you're using both of them, right? Both of the heads. Is that okay? So that's the sternocleidomastoid. Now you don't have to know this one, but let's see if you guys can figure out where you would look for it and what it might do. The sternohyoid, where would it be? From the sternum, that's the origin, to the hyoid bone. What do you think it might be able to do to the hyoid bone? Not up, down. Yeah, down. Pull the hyoid bone down. Does that make sense? Because it's always origin listed before insertion, which tells you action, right? If you know that when a muscle is named like that, the origin is always listed first and then the insertion, then you can figure out the action, right? This is why I wish all muscles were named that way, because then you're like, I know exactly where it is, I know what it does, right? But they're not. Okay. And then muscles are named for their number of origins, and then we'll do some like practice with this stuff. Okay. Sometimes muscles have more than one origin, right? They share a common insertion. This one is not named that, but some of them are. A muscle that is called a biceps has two origins with a common insertion. Yes? Okay. We've got two different biceps muscles. What are they? Biceps brachii, yeah, and the
Biceps femoris.
biceps femoris. Biceps femoris is where? Anybody know?
In your back.
No, we already did all those. Can't be there. It's on the back side of the leg, okay? So, biceps femoris, two origins, common insertion. before you even learn it, you should be able to tell me what that one does. I'll go ahead and get you started and tell you its origin is on the femur, yeah, and its insertion is past the knee. What can that muscle do? Flexes the knee, flexes the leg at the knee. Got it? Does that make sense? Okay. So that's a biceps muscle. You, of course, also know a triceps muscle. Yeah? And it is your what? Triceps brachii. Okay? You probably already know, but tell me what it does. Extension of the forearm at the elbow. Yes? Because it crosses the elbow joint on the backside. Good? Okay. Now these little bastards are the hard ones. The quadriceps femoris. Okay. So actually, the quadriceps femoris group, they used to call it one muscle, but now they separated it out. It's 4 muscles, and we already know what they are. It's the rectus and then the 3 vastuses, right? Okay. But collectively, they're called the quadriceps femoris group. They all have the same insertion, which is past the knee on the anterior side, okay? So, but I'm going to tell you a little confusion stuff about this so that you don't get confused later. You ready? 3 of those 4 muscles go from the thigh. Its origin is on the thigh. And the insertion is past the knee, right? What can those do, those 3 muscles? Not flexion. Extension of the leg at the knee, yes? But one of the little bastards has another function because it starts up here. So it runs on the anterior surface of the hip and then inserts down here. It has 2 possible functions. What can it do at the hip? Flexion of the thigh at the hip, yes. And then what can it do at the knee? Extension of the leg at the knee, yes? Does that make sense? Okay, but only the one that crosses up here, right, can do that. It's the only one that can move those 2 joints. Does that make sense?
Lateralis, right?
Okay. What?
That's the lateralis.
I'm going to tell you. Which one is it? Which one is it? You can look it up. Okay, so that's quadriceps, okay? So now we're going to quiz ourselves and we're going to see if we can figure out what kind of information is in the name of a muscle. And then, if you can figure out the information that's in the name of the muscle, let's see if we can logic our way to some actions, right? Okay, if a muscle is called the tibialis anterior, of course, tell me where you would look for it. Yeah, anterior surface. Now let me ask you a logic question. That muscle is more likely to be responsible for dorsiflexion or plantar flexion. Think about it. Dorsiflexion, right? Because where are muscles that are responsible for plantar flexion? On the back side. So here's what I am trying to do for you. Hopefully you see me reinforcing it. This is all a narrative, right? It's all a puzzle. And if you know pieces of the puzzle, you don't have to memorize the entire damn thing, right? You're like the tibialis anterior surface of the tibia. I can't quite remember what it does, but I'm going to guess that it's not plantar flexion. It's probably dorsiflexion, right? Okay, let's do another one. The temporalis muscle, you know where to look for it? Yeah? It's running over the temporal bone. If I tell you that it runs from the temporal bone and inserts onto the mandible, you should be able to tell me what you think it does. Elevates the mandible. Yes, exactly. Got it? Right? So you attach it, and then you can figure out what it functions. Good? Okay? Are we good? All right. How about, we already did the sternohyoids. You got that one. You know it pulls down. How about the supraspinatus? Give me, you know kind of where it is, right? On top of the spinous process of the clavicle. Give me one idea about what its function might be. Yeah, it could abduct. If it's on the top, it could pull it up. It could elevate, right? It's not going to depress, and it's not going to abduct, right? That wouldn't make any sense, right? So you can start to sort of process of elimination with functionality. Erector spiny muscles. Where do I look for them first, and what do I know about them? Erector, rector, straight up and down. Where are they? Spine. Okay, 2 possibilities for function. And students will put any damn one they want, but only one of them makes sense. Are those muscles responsible for flexing the vertebral column or extending the vertebral column? Extending, yes. That makes sense? Extending the vertebral column because of the surface that they're on. All right, flexor carpi radialis, help me find it. Which side? Anterior side, inserting onto the carpal bones. And which side is it on? Of the lateral side. Tell me one possible action. Flexion of the wrist, right? Or flexion of the hand at the wrist. Does that make sense? Flexor carpi radialis. If it was going to have any other function, it would be like something moving it out that way, but we don't really have much of that function there. Okay. Extensor pollicis longus. Help me find it and figure out how to tell it from anything close to it. Okay, where is it? Extensor, what does that tell me? Yeah, on the posterior surface. And the attachment point is the pollex. Okay, and what does longus tell me? Yeah, there are two of them, and this is the longer of the two long tendons. That got it? Okay, so I know that you won't be able to do that when you first learn the muscles, because first you're just like pointing, right, and trying to learn them. But later on, the deeper learning happens when you start trying to put the logic to the muscle and the action and the attachment points all together. I realize completely that that does not happen on day one, right? That's part of the reason that you get some time for absorbing these muscles, and part of the reason we put in a study day before your whole study week, before your lab practical. Okay, everybody good? Okay, questions? No? No? Really? No questions? Oh, wait, there's more. Let's do these. Oh, we already did those. Depressor anguli oris, we know where to look for that one. Vastus intermedius, big muscle in the middle of some other muscles, right? And the levator scapulae, you know exactly where to look for it. It's going to be on the top side of the scapula. Good? Okay. All right. So, So here's how you are going to be quizzed on this, but it won't be until next Thursday. My first quiz for you, especially because some of you guys missed lab on Wednesday, is not a memorization quiz. It's a logic quiz. So do you understand basically how muscle mechanics work? If I, for instance, told you that there is a muscle that is on the anterior surface of the thigh, crossing the knee and inserting onto the tibia, and I say, which of these actions would this muscle possibly do? And I would give you flexion of the thigh at the hip, extension of the thigh at the hip, flexion of the leg at the knee, extension of the leg at the knee, right? So you could figure it out just by understanding muscle mechanics, or I could do it the opposite way. And this isn't rote memorization yet, it's just figuring it out. I could say, here is a muscle, it is attached from the scapula and goes to the posterior surface of the humerus. Tell me what it does, right? Which of these is reasonable? Or I could say, this is a muscle that does abduction. Which one of these two is the origin and which one is the insertion, right? That make sense? So the first time you're quizzed, I want you to like really, really be critical about whether you understand the mechanics. The second time that you are quizzed over muscles in here, it will be putting those mechanics together with the memorization you're supposed to have done in lab. So it will have specific attachment points. I'll say, identify this muscle from its attachment points. It starts here, it attaches here, it does this. And you're like, oh, I know what that muscle is, right? That makes sense? So we'll just like space it out. But the first thing that I need you to do is just to try to get the logic down, right? Okay, cool. And that won't be until next Thursday because I need everybody to be able to go to lab before then, including the poor Wednesday snow day people. Sorry, Wednesday snow day. Okay. So now we are going to change gears and we are going to go to muscle tissue, and this stuff will not correlate to lab at all. This is the stuff that you are going to need anatomical understanding in order to understand physiology. So what we will be doing in this part of the notes is we're going to be drilling all the way down from gross anatomy to like even the proteins that make up muscles so that we can start to understand how muscles contract. We don't do the real hard physiology in here. We just do the anatomy that leads up to it. Right? And I add just enough phys so that you understand why the hell I'm teaching it to you, right? And then you'll learn the actually complex physiology when you get to phys. So your objective will be to try to understand it well enough that it sticks and hold on to it till phys. Okay? All right, so first, before we get into the specifics of muscles, let's talk about what muscle tissue has in common with other tissues and the differences. Muscle is excitable, meaning that you can give it an electrical stimulus and it will respond. It's electrically excitable. All muscle tissues are, and then one other kind of tissue is electrically excitable. What's that?
Cardio.
All three muscles, and then one other. Yeah, nervous tissue, right? And that means, of course, that if you got electrocuted, those are the tissues that would get trashed, but it also means that you have the ability to generate your own electrical stimuli and respond to them internally. Muscle is unique in that the way that it responds to an electrical stimulus is with contractility. If you stimulate it, muscle is the only tissue that will shorten, okay? So it actually shortens upon stimulation. And really what you're doing when you're doing contraction is you are converting one form of energy to another form of energy. You're converting chemical energy in the form of ATP to kinetic energy in the form of action, right? And you've learned this a lot of times. You guys know that energy conversion is really inefficient. You lose between 60 and 90% of the energy during the conversion process, and you lose it as that unusable form of energy called what? Heat, yeah. So you guys know, of course, muscle contraction heats up your body, right? Because you're doing all of those energy conversions. Okay, the other things that are true about muscle is that muscle is extensible because it's got a really complex connective tissue wrapping. Muscle can, for instance, be stretched. So if I was going to do a quadricep stretch before running, right? You can do a quadricep stretch. And it's stretchable. When you stretch the muscle, you're less likely to do damage to the muscle. But it's also elastic enough that when you stretch it, it's not just going to get floppy and flaccid. It's going to go back to its original position just with a little more range of motion. So it's got both of those characteristics. And then I do want you to review if you need to. I'm not going to teach it again, but I want you to remember that muscle table that we did in the histology part where we talked about number of nuclei, striated, where you find it, all that stuff. So you're responsible for that again. And then let's talk just a little bit about the functions of muscle tissue. We usually think about muscle as being, the source of wiggling, but it's not always wiggling because muscle also helps you hold still, postural stability, right? And then we talked in the joint portion when we said that a muscle spanning a joint helps stabilize a joint, right? So you can stabilize joints, okay? And then because that energy conversion produces heat, you can use muscle for heat production. So I'm sure I was not the only one that was scraping a foot of snow off my car this morning and shivering my butt off because I just didn't find gloves before I did it. Why the hell did I do that? Like every time I do that. So heat production. Muscle is also sometimes just supporting things. It's not so much about wiggling in some places as it is about support. You've got a floor of muscles right here that's keeping your junk in. They're called the pubococcygeal muscles or the perineal muscles. Those muscles are helping to keep your urinary bladder up there and your uterus up there. And if you have a whole bunch of big-headed babies, you can rip the hell out of those muscles and it'll all flop out. That's what they should teach in sex ed. Don't you think? Right? You really don't want teenagers to have sex. You're like, hey, flopping junk's going to flop out. Just flop around down there. It doesn't flop out of the skin, but you can have uterine prolapse in which your uterus just flips down, or urinary bladder prolapse, right? So these are supposed to stay nice and intact, we would hope, right? Let's try to keep them. In addition, the muscles here, your abdominal muscles are, of course, for movement, but they're also helping to support and keep your gut pushed up against the body wall. And if you destroy those muscles, like with an emergency abdominal surgery, you can lose the sort of packing tape nature of holding your body again. So, for instance, if a woman has an emergency cesarean section, because one or both of them is at risk, then they're not going to take the time to separate the fascicles, and they're just going to slice straight through it. And when that occurs, what happens is you'll lose some of the structural integrity. So if you had, for instance, your transversus abdominis muscle, and imagine it's like packing tape holding everything back there, and then you slice through it. Well, the packing tape doesn't grow back together. You just have two smaller pieces of tape, which means that it's not holding and supporting as well. So you can have a little pooch. I'm not talking about subcutaneous fat. I'm talking about the muscle integrity could be lost, and you can have a little pooch even if there isn't any subcutaneous fat to speak of.
Is that, I'm just curious, is that fixable? Does it ever grow back
No.
again?
not when you have, I had a planned C-section. They don't have to do that, by the way. I have a heart problem, and they knew that I couldn't go into labor, so we had my C-section planned, for months. So my doctor, separated all of the individual little fascicles for cesarean section. But if you have an emergency surgery, what happens is you're going to kind of develop scar tissue between the two of them. So I'm not saying you'll never have abs again. They're just never going to be all one big piece again. They don't grow back together. They're independent of one another. Go ahead.
Yeah, so I had an emergency C-section, and there you can feel the separation.
Mm-hmm. Which way did they cut? That way or this way?
This way,
Mm-hmm.
so transverse.
Yeah.
But there's definitely, you can feel the
separation of the muscle,
yeah,
right?
It's not smooth.
Yeah.
And it's not a huge bulge or anything
Right.
like that.
But it's different than it was before, right? Yeah. But everything's different after you have children, honestly. It's just nothing is back to original factory settings ever again. It's just not. It's fine. It's fine. I mean, it's fine. Okay. What? It's worth it. I mean, some days it's not worth it. You're like, what the hell? All this, and I lost my abs too. Thanks. Okay. The other things that muscle tissue does for you is guarding openings, right? Both skeletal and smooth muscle sphincters guard openings. And then keeping your fluids moving. All three kinds of muscle keep your fluids moving. Heart for obvious reasons, right? Okay. Smooth muscle because it's in the walls of tubes, right? But what we don't think about is that skeletal muscle also keeps fluids moving, simply because, so I've got veins in my legs, and the veins are delivering blood back to my heart, right? So it's working against gravity, right? And they're pretty low pressure because they're veins, right? So how can I help to get blood to move through them? Well, what happens is if you use your skeletal muscles, if you walk around, they actually push on the veins and help to increase return back. So if you're more active, you have better blood flow, not just because of what your heart is doing, but also because your skeletal muscle is helping to move the blood back. Is that good? It also helps to move your lymphatic fluid. All right, so with that in mind, let's start on the organization of a skeletal muscle. Okay, so I know you guys are used to thinking about skeletal muscle as skeletal muscle is skeletal muscle tissue. But what I need to tell you is that a skeletal muscle is actually an organ. So it's going to be skeletal muscle tissue plus some other tissues. You're going to have to hook up the nervous system to it. You're going to have to wrap some connective tissue around it. And you're going to have to give it some blood flow as well. So let's look at a skeletal muscle, okay? So here is a whole skeletal muscle. We're going to break it down in just a second. I think this looks to me like it's trying to be the short head of the biceps brachii. I'm not sure because they didn't label it, but I think that's what it's trying to be. I'm not sure. But regardless of what it is, let's put it together with things that you already know. You already know what the superficial layer of the periosteum is made of, right? What's it made of? Dense irregular connective tissue, right? And you already know what a tendon is made of. What's a tendon made of? Dense regular. So here's how I make that a really strong association. We already talked about this. We take the dense irregular of the periosteum, and all that we do is weave those collagen fibers straight into the dense regular of the tendon, yeah? So that there's no seam, and it's a really strong association. But now I'm going to tell you that the way that you make sure that the tendon really never gets yanked off the muscle is you make the tendon continuous with the connective tissue around the outside of the muscle. And if you knew that that muscle was going to undergo a hell of a lot of stress, especially in this dude, what kind of tissue would you wrap the entire muscle with? Dense irregular. That's what I would use too. The entire muscle is wrapped in dense irregular connective tissue. So the outer portion of the muscle is wrapped in dense irregular connective tissue all the way around the outside. And it gives it structural stability because, of course, you're going to be generating quite a bit of tension with that thing, right? So dense irregular connective tissue all the way around the outside. Good. Okay. How do I make it strong? Well, I just weave them into one another. I take the tendon, the collagen that was in the tendon, right, and weave it into the collagen that's in the outer layer of the muscle. The outer layer wrapping around the muscle is called epimysium. Break that down. On top of the muscle. Exactly. That's the connective tissue on top of the muscle. It's also sometimes called fascia, right, around the outside of the muscle. Everybody okay with that? So go ahead.
How does that fit into the periosteum?
Okay, so the periosteum is the outside of the bone.
Right.
Got it? and then it's continuous with the tendon, and then the tendon is continuous with the epimysium. Good? Okay, so, but now that's not strong enough. This thing undergoes quite a bit of stress. So we have layer after layer after layer of connective tissue giving the muscle its structural integrity. Here's how we do it. We take that epimysium and we wrap it all the way around the muscle, and it's nice, thick connective tissue, dense, irregular connective tissue. Then I wrap it all the way around, keep it continuous, take a thinner layer of it, and wrap the thinner layer around each individual little bundle of muscle fibers. A bundle of muscle fibers, again, is called a fascicle. So here's what happens. Watch. Here's the epimysium, wrap it all the way around, and then fold it in and wrap it around each individual little bundle, right? It's thinner when it's in there, and it's like kind of between dense, irregular, and loose areolar, kind of like a weird hybrid little tissue because you don't learn all the tissues. So it's wrapping around there. So that's still strong, right? Now I've got a connective tissue layer around that one, and then I'm not done. This one is called perimysium. So epi around the outside, then fold it in, thin it out a little bit, wrap it around the fascicles. That's called perimysium. And then fold it in and wrap it around every single muscle cell or fiber, right? It's thinner in there, right? And that's called endomysium. And the epi, the peri, and the endo are all continuous with one another. So it's a really strong association with the muscle, right? So this dude could try to pick up a Volkswagen, and are his biceps brachii going to just bust apart? No, they've got so much strong connective tissue around them, right? And yours won't either. You just won't pick up the damn Volkswagen. Let's just be honest. You'll be like, still there, I tried, right? Still a Volkswagen, still on the ground, okay? So, but I'll show you, want to see an even worse one? This is one I use in Fizz. Where is he? Where are you, dude? It's up here. Here we go.
Oh, man.
Do you like him? I'm pretty sure that all just happened naturally, don't you think? Just naturally. Just like, he just like woke up one day that way and he's like, wow, this is amazing. I know, that's right. At some point, and like, we talked about how having too much muscle can reduce mobility. Do you think this dude can zip his pants?
Can you even wear pants?
I don't, yeah, you'd have to have special pants. He wears sweats all the time. Maybe he just walks around like this, right? And don't tell me that this was not an implant, because he's used so many steroids that those cannot be real. Those cannot be real. Steroids shrink up your testes like to the size of English peas. They do. So you're like super hot, but you have no sex drive, and you couldn't even have sex if you wanted to, and you're thinking, what was the original plan here? I don't know. Okay, so epi, peri, and endo are also all continuous with one another, okay? So epi, peri, endo, so you wrap, you fold in, you wrap, you fold in, you wrap, okay? And the order kind of makes sense. On, right, around, inside, right? Okay, epi, peri, endo. And then, of course, we already said this, but the epimysium on the outside would be continuous with the tendon, and then the tendon would be continuous with the periosteum. So does it happen very often that people yank a muscle completely off a bone? It happens far less often than you would imagine. It's a really strong association. Does it ever happen? Yeah, right? Just not very often. And when you do, usually you only rip it a little bit, not the whole way off. Every once in a while, somebody rips the whole damn thing off. You have to like sew it back on there and stick it until it like regrows the connective tissue. Go ahead. What? Yeah, weightlifters do it, and sometimes like if you just get hit from the wrong angle, you can rip it off, like football players. Did you know that football's not good for you? I mean, I'm sure that's new information for you, but they didn't like it when I said that in Texas, especially because it was before all the concussion information. I was like, they're like, because Texas is like super duper duper into football and religion, and I just like I'm not interested in either one of those things, right? I'm like, I just could care less about either one. And I'm like, that's not good for you, and they're like, blasphemy. They cared more about that than when I taught evolution. You can talk about evolution, but do not talk about football.
Dr. Farnsworth wouldn't appreciate that.
He wouldn't appreciate what?
Your football blasphemy.
Oh, he doesn't mind.
Every example is a football example.
It's fine. We have come to a situation in which he thinks he's right, and I know I am. So, it's okay. We're buddies. Okay, so now let's talk about blood supply and nerve supply to the muscle. So here's the deal with blood and nerve supply of the muscle. Muscles are really, really highly energetically expensive, right? So they need a really good blood supply. And here's what happens with those. Generally speaking, kind of like with a bone, you have one big artery that goes in, one big vein that comes out, and one big nerve, right? And then it's going to have to split and split and split into smaller like arterioles and everything to get blood supply all the way to the muscle fiber. So it's going to have to like snuggle up to every single one of these. Muscle is so freaking vascular that every single muscle fiber has to be cuddled with a net of capillaries. So the tissue is really, really red because it's got such a really rich blood supply. That is also the reason that when you eat muscle tissue, as gross as it is to think about in this particular context, but if you eat a steak, it's a cow muscle. It's a cross-section of a cow muscle, right? That's what it is, right? Why is it so red? Well, because it's got all this vascularity that you're actually seeing there, right? All of the vascularity around there. So super duper vascular. And also highly what we call innervated, and you know that word. Innervated means that there must be actually a nerve that's going to every single muscle fiber, and this is really different than other tissues. So if you look at these three muscle fibers, these are three muscle fibers right here, and we'll break down why they look so weird in a minute. But here's a muscle fiber, here's a muscle fiber, and here's a muscle fiber. Every single one of them must be told what to do by the nervous system every single time. They have no autonomy. They won't do a damn thing on their own. Okay? So, for instance, if you guys in the front row were all cardiac muscle and I gave her the command to contract, do I have to tell you? How does cardiac muscle get around the need for innervating every single cell? Desmosomes and gap junctions, right? You're talking to each other through gap junctions. But with skeletal muscle, what I'm saying is, okay, here is an axon. The neuron cell body is up there somewhere, right? Okay. If I cut this branch of the axon, this one is paralyzed. And it's not going to do anything ever again unless and until you reinnervate it with the nervous system. So skeletal muscle doesn't do anything without being told to by the nervous system. It's kind of like a teenager, right? Okay. So if you ask your teenager to take out the garbage very nicely, but you do not ask them to replace the liner, what is the likelihood that the liner is going to get replaced? It's just not going to. And then when they come back and you say, hey, you didn't replace the liner, they will literally say you didn't tell me to, because they're all skeletal muscle fibers. That's what they are, right? And my 18-year-old, he's my stepson, but I've had him since he was 3. So he is the worst about being a skeletal muscle fiber, and he didn't understand the metaphor, but I explained it until he made me shut up. Gavin is a delightful human being who is now out on his own. I hope he's surviving. I don't know. Gavin was such a skeletal muscle fiber that when he took a shower, first of all, I'd have to ask him to take a shower up until he moved out of the house. I don't even know how the hell you have to ask people to take a shower, right? But then when I asked Gavin to take a shower, I figured out by process of elimination and a lot of discomfort that if I didn't ask him to wash his hair, he would not. If I didn't ask him to use soap, he would not. Obviously, if I didn't ask him to hang up the towel, he sure as hell would not, because you know that ain't happening. But this is the bad one. Gavin, I figured out, would not put on clean underwear unless I explicitly said, do not put your dirty underwear back on. You need to put that in the laundry. I didn't even know people would consider putting on dirty underwear. Did you? I would literally wear a swimsuit before I would put on dirty underwear. And I have before, as has every woman in this room. You're like, I'm out of underwear. Swimsuit. That's what's going on.
Big Hero 6 inside out?
What?
Front back?
Well, inside out on a really rough day, like maybe camping, right? But swimsuit goes before inside out to me, right? If I'm camping, I'll flip them around, but it's not going to last so very long. So that Gavin, this is Gavin, right? No! What's going to protect my pants?
I'm just saying, no way you're flipping them inside.
But yeah, that was an interesting conversation when my husband's like, you did what? And he's like, well, she didn't tell me. So I didn't tell him to change his underwear. And so we got to the point that there was a dry erase list on the mirror of Gavin, heart, will you please, heart, do this list of things that grown-ass humans who are 6'6" know how to do, right? He's like huge too. Anyway, this is Gavin. So, so what happens is if I damage this one, none of these would ever do anything, right? If I damage this one, that one is paralyzed. Does that help you get an insight as to some things we're going to learn later? If you have nerve damage to maybe a flexor digitorum, right? Does it help you understand how you could have complete paralysis and no ability to do this, right? Or weakness and no ability to generate any muscle strength. Weakness means that you damage the connection to some of the cells, but not all, right? And so the other ones are still working, right? Complete paralysis would mean that you damaged all of them. Does it also help you understand how when you damage, for instance, your spinal cord, everything lower than that is paralyzed and the skeletal muscle will not do anything? Good? Doesn't have any spontaneous capacity. What?
It's not fixable.
If you damage your central nervous system, your spinal cord, probability is pretty close to 0, with the exception of some experimental stuff that they're trying. If you damage your peripheral nervous system, like a nerve, it's really slow and it's not guaranteed, but you may get some reinnervation in about 2 years. It's really slow to work. And we'll talk about that when we get to the nervous system. Okay, so this is skeletal muscle fibers. So they need to be stimulated by a motor neuron. And you may not know motor neuron, but you know neuron, right? And motor is just controlling activity, right? And the motor neuron is coming from a specific division of the nervous system, which will make sense later. It's called the somatic division of the peripheral nervous system. You don't have to know that yet. Okay, all right. So now what I want to do is I want to look at a single muscle cell. Oh, by the way, this site at which the neuron communicates with the muscle right here is where lots of interesting physiology happens. It's called the neuromuscular junction. And when you get into phys, you start talking about muscles from about right here. So anatomy got you to this point, and phys is going to take you from there. Okay, so if we look at an individual cell, first thing we have to acknowledge is it doesn't look like any other cell that you ever learned in all of 1610, right? You learned all of those damn parts in 1610 and what they did, right? And then they show you something like this and tell you it's a cell. It is a cell. It has all of the cell parts, but then the weirdness about it is related to its unique function of contractility, right? That's why it looks like that. But here's something unfortunate, and I don't know what to tell you. They just did it. They did it to me too. They renamed every damn thing inside the cell. So you don't get to call it cytoplasm anymore. It's sarcoplasm. The prefix sarco means flesh. It's used to refer to microscopic muscle structures. You don't get to call it the cell membrane anymore. It's called the sarcolemma. You don't get to call it the smooth endoplasmic reticulum anymore. It's called the sarcoplasmic reticulum. So they renamed everything, and I'm very sorry, but that is the terms that they use in phys, so you have to learn them. Sorry. I don't know how they did it. They did it to me too, and I was pissed off. So I was like, what the hell? You just gave me a whole class, and now you're changing the name of everything. So here's the deal. First, let's talk about how big muscle fibers are. First off, they are microscopic in width, like from 10 to 100 micrometers, but they can be up to a foot in length. Okay, so they can be pretty long. Does anybody know what the longest muscle in the body is? It is one of the, it's the other one. It's the one, do you know the one that goes from here, anterior superior iliac spine, goes that way? Yeah, that's the longest muscle in the body. It's not particularly impressive on me. I'm not even 5'3", but on Jason Momoa, it's impressive, as is everything else. So it's long. It can be really long. The muscle fibers can be up to a foot long. Okay. So now let's start learning the names of the structures that you already learned the names of. First off, the cell membrane on the outside of the cell, it's still a plasma membrane. It's still a cell membrane. They renamed it. It's called the sarcolemma, which means basically layer of flesh. Kind of gross. Sarcolemma. Now, let me ask you a concept check question for you. Okay, so here is the endomysium. What is the relationship of the endomysium to the sarcolemma? Which one's superficial and which one's deep? Yeah, the endomysium is superficial, right? And then you run into the sarcolemma, which is deeper, right? And the sarcolemma is basically the boundary of the cell itself, right? That makes sense? Okay, so we're going to have our sarcolemma right here, and you start getting in there. It's got it labeled. I don't know why the hell they labeled it right there. They should have labeled it right there. Okay. So it's just a cell membrane. It's a phospholipid bilayer, just like you learned before. It's the same thing. And then the cytoplasm or intracellular fluid inside is not called cytoplasm. It's called sarcoplasm. But look, there isn't much room for intracellular fluid or sarcoplasm because it's really full. But there is sarcoplasm in there. There has to be. There's got fluid in there. So what's in the sarcoplasm? Well, all of the organelles are in there, of course. So your nuclei, yeah? Can you see now with this picture why the nuclei in skeletal muscle fibers are peripheral? Why? Because what's going on in the middle? Yeah, like there's a bunch of crap in there. There's no room for them, right? So they get pushed up against the side. So peripheral nuclei. In addition, some other things that you can see in here is that compared to other cells, there are boatloads of mitochondria inside skeletal muscle fibers. Does that make sense to you? Because mitochondria, ATP, exactly. Powerhouse of the cell, right? Powerhouse of the cell. Everybody learned it. Everybody did. So there's a whole bunch of mitochondria compared to other cells. And then there's two things in the sarcoplasm that you can't see but are important. So let me tell you about them. They're functionally important. They're not structurally interesting to look at. In that sarcoplasm, in addition to all of the other stuff, and the rest of the stuff we'll name in a minute, there are two kind of storage tanks. One of them is glycogen is stored in the sarcoplasm, and glycogen is stored what? What is it? Glycogen is stored sugar, exactly. It's how we store sugar. So now we're starting to see a story here. We've got boatloads of mitochondria and some sugar stored up, right? And then also in there, again, not visible in this image, is myoglobin. Myoglobin is similar to hemoglobin. Hemoglobin binds to what? Oxygen, yes. Myoglobin binds to oxygen as well, only it keeps a little piggy bank of oxygen inside each skeletal muscle fiber. So now what I have stored is sugar and oxygen, and I have boatloads of mitochondria. Do you see what I have set up? I have set up the capacity to do, yes, ATP synthesis, cellular respiration, right. And what I've done is I've set it up so that I can always do it quickly. And this is important because this is your emergency response tissue, right? This is what gets you out of the way of a bus if a bus is coming. Even if you haven't eaten in 72 hours, right? It'll still get you out of the way of a bus. And why? Because it always keeps its own little piggy bank of oxygen and little piggy bank of sugar, and it's got mitochondria. So if a bus is coming at you, you don't have time for your liver to give you some sugar, right? And you don't have time for your respiratory system to get you some oxygen. So you always keep your little piggy bank in there. So you always have the access to at least a little bit of cellular respiration inside that. And it also changes the color of the tissue. Because when oxygen binds to hemoglobin, what does it do to the color of your blood? Makes it red. And when oxygen binds to myoglobin, it makes your muscle red. Yes? So now if you think back to a steak, cross-section of a cow muscle, it is red for two reasons. The oxygen bound to the hemoglobin on the capillaries, which are abundant, right? And the oxygen bound to the myoglobin inside the cells, right? But you could experiment with that if you wanted to, waste a perfectly good steak. You could just let that steak sit out on the counter for like 2 days. Come back, what color would it be? Brown, because it would have lost its oxygen, exactly. Or you could cook it, right? And dissipate the oxygen off by that mechanism, right? Okay, and the more you heat it, the more oxygen you lose. So if you want to make a bad steak, right, you cook the hell out of it. You cook it well done, right? You dissipate all of the oxygen off, right? That makes sense? Okay, so we will pick up there next time, and the next thing we will talk about is what the heck these things are.